Hi everyone, this is episode 4 for Behind the Scene Revenue Stream. We are with Dr. Fish, a podiatrist who has been successful in the business and an entrepreneur. And with me, I have my partner, Dr. Leon, a retired podiatrist serving the healthcare provider, from last 25 years and now as a medical consultant. We'll be all discussing how Dr. Fish has become a successful, I would say doctor at the same time. And, doctor, how was your experience when you started up? I just want to start with, a bit of the kind of a ice-breaking topic so the audience can understand better about you. How was it like when you just came out of the, residency? Was it so harsh, or is it just everything goes very smooth?
So, yes, harsh. It wasn't smooth. It went as planned. Like I planned on it being a bumpy, like rocky road. So I finished residency in 2020. Is middle of COVID. It moved. I was in Ohio. Moved back to Washington, my hometown, to open a practice from scratch. That was always the plan from the time I started residency. It was finish residency, move back home to Washington State, open a practice from scratch, and go from there. So I'd planned on doing that. COVID did not help. Being in the state of Washington with COVID, we were like super locked down. Ohio was starting to open back up when we moved out of Ohio. Then moving into Washington, it was like don't go over to your family's house. You can't go into the hospital. It was like super locked down. So starting a business it wasn't a good time to start a business, but it was. I already decided, so it was like I had no other. I did have a choice, but I had no other choice that was going to work. I had to make it work, so we made it work. And it was harsh. It was bumpy, but I planned on it being bumpy, and I started from scratch. I knew I was going to have nothing, and it was okay. I was okay with that, and I knew it was going to take like a year or two before I got busy enough to, be able to make any money or do anything or really make any kind of like significant impact.
So the first question that I have for you is, while you were building up your practice, was your wife also working too at the time?
Yeah, that was that was part of the plan. So I've been married for 10 years. I've been married for 5 years before starting the practice. So my wife, we were married in school. We were, stayed married all through residency, and she was and still is a physician assistant. So she had a good job, made enough money to support the whole family, and made enough money for me to make nothing. We didn't make a ton of money, but she made enough money. I don't know, $150,000, however much she was making as a PA, for us to live while I, just ran in the negative for like a year and a half before I, started making any money. So I was married. We had a child, and she was one, I think, at the time when I opened the practice, and she worked full time, and I worked full time, and she made all the money. I made $0 for probably a year. Yeah.
But then you're still together, and 5 years later, you have this beautiful practice now.
Yeah, very happy. Yes, she's very happy. She's very proud of me. She's actually just put in her 2-week notice. She's quitting. She wants to spend more time with our 6-year-old. She's 6 now, and and we're able to do that. So I'm able to provide for the family, for my own family, and also for like 15 other families for the employees that work here at the office.
That's a good perspective to have anytime you're running a business in terms of what's at stake and how important it is to always maintain the practice at all costs. Meaning that the marketability is based on the brand awareness.
Indeed.
And the brand awareness is based on how good you are at keeping a good brand based on your name. So your name is worth everything. That's what I'm trying to say.
Yeah. That goes for not only the patients and the community and like the doctors who refer to you, but like also your employees. Like your brand is everything. If you don't have a good reputation, nobody's going to want to work for you.
Correct.
Yeah.
and the
and keeping
patient
good
trust
employees
is
is it's hard. Anybody who's run a business knows it's hard, and like the people make it hard, the employees make it hard, like the regulations make it hard. And healthcare, there's a little more complexity, but in every industry, no matter what you're in, like you're a business owner, most business owners aren't greedy, like stingy, bad people who just want
right.
all the money and want to make their employees suffer. Most business owners are like me, and they want to like give their employees benefits. Most business owners want to pay their employees as much as possible, want them to have like good work-life balance. And you have to run a business, you have to make money, and you have to treat people well. It's hard. It's a hard balance, but if I feel like if you do things the right way and you try to be a good person throughout the whole thing, things work out. It's still hard. Yeah.
I think the most important
That has been
lessons
said,
that you're
doctor. You said,
go ahead.
sure, go ahead, doctor.
No, I was going to say the most
No, no,
important
go ahead.
takeaway from
I
that
was just
is
asking, doctor. Yeah,
Oh shoot.
no. Go ahead.
thank you, doctor. I just got the question out of his actually, saying that you want Clover Podiatry to become a nationally recognized podiatry brand by next, 2035. How's that, thing will be achievable? You will get there. What does the scaling healthcare right away actually looks like according to you to get there actually?
So I kind of had big goals when I opened the practice. I named it Clover Podiatry. I didn't want to name it like Dr. Fish Podiatry. I didn't want to name it like Southwest Washington. I didn't want to name it like a local name. Um, um, because I always imagined, hey, if I'm going to do this, I'm going to do it well. I'm going to do it right. I'm going to be successful, and it might be neat to have a few locations here and there. And then as we've grown, we've done well. We've grown faster than most. We were a little more profitable than most other offices. Our office is a little bit nicer than most. Um, and
Hmm.
I've spent a lot of money on consultants. I've had several different consultants, some podiatry specific, some are just generalized business specific. And I was asked about a year ago, they're like, what is the goal? Because if you don't have one, you're not gonna it's not gonna happen by accident. You're not just gonna like be a billion-dollar company by accident. So what do you actually want to do? Do you want to have 5 clinics? Do you want to have 10 clinics? Do you want to employ 1,000 doctors? And the goal was like, if I'm going to do this, I'm going to do it right. And I think I have the ability to. I was like, I think it'd be neat to be over the course of my career, 25 years, 30 years. I'm like, if I did something the right way for 30 years, being the number one podiatry practice in the country is not unreasonable. Like that's a long, long, long time, 30 years. I say that's not unreasonable. There's not really a nationally recognized podiatry brand. There is in dentistry, there is a little bit in like physical therapy, or
Hmm.
there's chiropractor offices that are like franchise. There's no real that doesn't exist in podiatry. And so I thought, like, if we're gonna what do I want? And I decided on let's just go for number one. Let's be the national leader. And the largest podiatry practices are 200, 300 doctors. There's some private equity groups that own several clinics that are a little disjointed, with several hundred doctors. And so I decided let's just go for being number one, which is going to be about like 200 doctors, around 400 or 500 employees, and around like it's 50 to 100 million dollars in revenue a year, which is a lot. Um, that's
Hmm.
the target. Long ways from there, but that's the target. We have
Hmm.
a plan to get there. We've like figured out what needs to happen year by year in order to get to that. Like 20 years is a long freaking time to do anything. So
Hmm.
it's a long time horizon,
The,
and it gives me something to like really dig my teeth into, look forward to over the long term. Yeah.
well, that's wonderful.
Uh,
All we need is a vision, first of all, to get there. Everybody does need that.
without a
Sure,
Yeah.
question.
go ahead.
Um, so right now, professionally speaking, where are you at in terms of that goal right now? You have the one practice.
Mhm.
Are you looking at expanding in your local area?
Yeah. So right now, 5 years ago, I started. We were in like a 1,500 square foot little office, 3 treatment rooms. It was me and 2 other employees. Uh, there was a local doctor who wanted to retire. He was turning 60. It wasn't that successful of a practice. He worked there like 2 days a week. He worked at a hospital or VA. We bought his practice, moved into his office. It was like 2,400 square feet with like 4 or 5 treatment rooms. Hired another doctor, then hired another doctor. Then we started getting busy, and got busy enough, and was making enough money. We a year ago bought a 9,000 square foot building. It's got 15 treatment rooms. There's now 5 doctors, and I think we're at 16 employees right now. We're trying to hire another one. We need some more help, another medical assistant. So, and then we did around $6 million in revenue last year. That number is a lot in the podiatry world, but like a lot of that was some like skin grafts. There's a lot of money in skin grafts. All that money's gone. This year we are shooting for 4.855 million. I have 4 doctors that work full time. I'm cutting back, and we're shooting for 1.2 million doctors in collections per provider times. Did I do that math right? I didn't do that math right.
You're getting close
Yeah.
on math.
Yeah. It was 1.2 million per. That's by like for a whole 2027. So we will do close to like $4 or $5 million, and that's without skin grafts now. So we've made up for what we lost in the skin graft money last year. I didn't want to base my entire practice off of skin grafts because we knew it was going to come to an end. The gravy train was going to die at some point. It was fun to ride in the gravy train, but a lot of people rode it too hard and too long, and there was a lot of people that are really big time suffering. And we're not in that bucket because we tried to do it the right way.
Yes.
$6 million in revenue, 16 employees, 5 doctors. We have 1 location, big location though. It's 15 treatment rooms.
So one bit of advice to pass on to the docs that are coming up is, how do you feel then about chasing trends?
Chasing trends?
Yeah, in terms of like amniotic tissue grafts. You just brought up a classic example. You see this all the time in medicine. Last year it was amniotic tissue grafts. A couple years before that, it was infrared light therapy.
Yep.
And you see these trends all the time where something popular comes up and then everybody jumps on it, and then the insurances say, whoa, you're spending too much money on this, we need to cut back or get rid of it, which is what happened in this case, in my opinion, with the grafts. It's just, it was too much too quickly, and
yes,
that's how we're at. But it's when you set yourself up like that, you also then screw up your the numbers of patients you need to be seeing in order to have a viable practice.
Oh yeah, you could. I mean, some people you could do like $10,000 a week on some of the skin grafts. You need like 1 patient a week to make $10,000. That's a lot of money in a week.
Right. But it's completely unrealistic for a normal practice.
Yeah, it's not. Yeah. Like I said, it was fun riding the gravy train, but not like putting all your eggs in one basket. That was a bad idea. A lot of people did that.
A lot of people got
but
burned
as far as the
that.
trends go, trends, in my opinion, like trends aren't bad. Usually the trends happen for a reason, like like laser therapy or red light therapy. There is some good science behind it. The skin grafts are very helpful. They do increase the rate of healing. We still use them every single day in my office. You just get paid way less for them. You get paid a reasonable amount for them now. So we still use them. They aren't garbage, and they weren't like they were trendy because you made so much money. So a bunch of people were just making money doing it, not actually
thinking about
the goal was to make the money, not actually like get the wounds healed.
Right.
We still use them. So it was, there's lasers are trendy right now. There's a lot of like toenail fungus treatments that are trendy right now. PRP peptides, exosomes, stuff like that's all trendy right now. I don't own a toenail fungus laser. I haven't seen good enough results with toenail fungus lasers recently. If they come out with a newer, better laser that actually has good results, I'm happy to treat people. And if they want to pay like a bunch of money to get a good amount of treatment, I'm happy to do the treatment and take their money. If it's all snake oil and garbage, like it's not worth the reputation. So if you're following trends just to make money, not cool. If the market wants something and you're able to offer it to them and it's actually helpful and it's going to make your reputation better, yeah, follow the trend. But don't jump on the bandwagon just for the money. Chasing money, you'll screw yourself over. Chasing good patient experience, you'll always win.
Right, which is the most important thing I pass on to young doctors is making sure that you're not first day, look at your fee schedule. Second day, pass the fee schedule off to the biller. Let him worry about the fee schedule and focus instead on the number of patients that are coming through the door. Too little, you don't have a practice. Too much, you also don't have a practice. But the right balance, you're perfect.
Yeah.
And just knowing how to ride that is crucial, and that's where a good biller comes into play, because he'll be behind you saying, you're using too much 11042. You might want to kill it a little bit, and figure out a different way, or maybe pass that work off to somebody else who is not utilizing that code too much. Stuff like that.
Yeah, I have 4 of the doctors that work for me. We just had this discussion yesterday. A patient called in. They were frustrated because she misunderstood what was said, but it was still a good opportunity to talk to the team about this. And I try to like pound this into everybody. She goes, "Hey, you guys called and said the doc was too busy that day, and so they had to push my surgery off. They were scheduled like next Friday. The doc was like, hey, I already have 4 cases. I don't want to do a 5th. We're going to have to push you off another 2 months. Patient was pissed, wrote a letter, called in. You guys are ditching me for 2 months because the doctor was going to be too busy." That wasn't the case. That's what the patient heard. So, I mean, there's some training to be done there. But the message was like, don't, this pertains to what you were just saying. The message was like, it was the patient's experience is the only important thing when you're going about your day-to-day practice and seeing your patients on a day-to-day. It's not like, how much money can I squeeze out of this visit? Can I dispense them a boot and justify it and, get paid the extra like $200 or $300 or $400, whatever it is. It's I don't really want to stay in the office till 4:00. Let's just cancel the other 3 patients, at the end of the day. Can you readjust them? If you put the patient's experience, if you focus on just making the patient's experience the number one like focus of your day, then you'll always have plenty of money. You'll always have plenty of respect. You'll always have plenty of patients. You don't have to do as much marketing. They'll talk about you. They'll love you. You'll have a great reputation. You'll be trusted.
Right.
If you chase money, you're going to end up screwing the patient. Just chase good patient experience the whole time. You don't have to bill all the different modifiers to get every little cent out of every little patient, because the patients feel that stuff. And it's like you said, do what's best for the patient and let the biller worry about the money. Don't do what's best for your pocketbook as the doctor. It's bad medicine.
It's bad medicine.
And it's bad business.
And in the end, you still end up not changing your financial outcome, because if you treat patients well, you give them good service, they come back and they want more service. Therefore, you're going to make more money.
True.
Long game is always better. You always make more money if you do better patient care.
Of course, without a question.
If you want to be really greedy, take good care of patients. Take good care of your employees. That's the greediest way to run a business.
Yeah, pretty much. Yeah.
You know what they say, do what you learn in the medical school, and let the billers take care of the rest, the business side of it at the same time.
Yeah.
So,
as I've always said, the billers are like the lawyers.
True.
Yeah.
They are. I heard that before as well. So, in terms of leadership, because right now you're in a kind of a position where you are leading the whole clinic, by your own, and this will go on as well. You will be spending more time in terms of leading everybody. So, what is going to be the hardest, leadership lesson that you have learned so far, and you can convey to others who are just, who can learn this in a very convenient way?
So for this would be advice or a good question for people who are wanting to open their own practice or do have their own practice, maybe a small practice, or
Hmm.
thinking about leaving their practice and opening their own. Um,
Hmm.
everybody tells you everywhere in every book, like good people are hard to find. That's a saying
Hmm.
that like all business owners use. Um,
Hmm.
it's true. The other part that is also true is that there are lots and lots and lots of good people. There is really abundance of good people. They aren't hard to find if you're a wonderful business and if you're a wonderful leader, because the good people all have jobs and they all work for like good businesses. The
Right.
crappy businesses, they leave the crappy businesses and go find somebody else better to work for. So um uh which plays a lot into like how good of a leader are you. The hardest
Hmm.
part of being a leader, to answer your question, or the biggest challenge is the is always the people. It's easy to run a little practice by yourself with like two employees, especially if one of them's your like wife or sister-in-law or something.
Right.
Um, just because there's only two people to keep track of, but when there's like 10 people to keep track of or 15 people to keep track of, you can't keep a track of all 15. You need
Hmm.
a lead MA who keeps track of all the MAs. You need the biller or the lead front desk person who keeps track of all the front desk people. And so it's being able to develop and encourage and incentivize and align other leaders to
Hmm.
perpetuate your culture, your values, your ideals, who report to you. So being able to develop other leaders, and then also being able to let go of the controlling every little bit of the entire business. That's
That is
that's the only way to
very good.
scale. It's easy to
Right.
stay small. It's easy to stay one little doctor in a few treatment rooms with a couple of employees. But if you do want to grow, which is what I want to do, you have to take off the hats, because the doctor wears the owner hat and the biller hat and the accountant hat and the
Hmm.
and the HR hat and the fire department hat and the landscaping hat. Like you have to be able to take off those hats if you want to scale. If you don't want to scale, wear them all and stay small.
No, don't. My opinion, don't. Don't. Hey, don't stay small. Get bigger, and also bring in help. Even though you feel like you don't need it,
True.
you really do need it, because you need, like you said, the wife is one of the few people that will always watch your back, will always
Mhm.
make sure that billing gets done, will make sure that everyone gets paid, and will be your, pardon the expression, your Luther anger translator. When you're playing the good guy, you need someone in the office to always play the heavy. My wife always would play the heavy in the office for that reason, because she's very good at
Yeah,
that role.
yeah, yeah.
But it's like you said, with scale, it's very easy when you start off just to be the one individual doctor. But yeah,
Mhm.
is you have to always be cognizant of having someone, if you're not doing it yourself, telling you, you need to do this at this time in order to build up and always expand. And your focus should always be, as the doctor, on taking care of the patients. You're the talent, as I like to say. You're the
Mhm.
you're the football player on the Bears. Hopefully, we'll win the Super Bowl this year, kind of player, and let all the ancillary players, the doctors, the coaches, let them handle all the stuff that does not involve taking care of patients. So your focus is just being the star and taking care of the patients. Very simple,
Absolutely. The
Exactly.
doctors have to do the doctor stuff,
right?
and the more non-doctor stuff that the doctors are doing, the less efficient your practice is, the less money you make, the less the
Right,
medical assistants make, the less the billers
right.
make, the less the owner makes.
So,
So
and start that
Exactly.
all early. Don't
yes, as
wait.
early as possible. Yeah, absolutely. If the doctor's cleaning the room, it's not that it's below the doctor to clean the room. It's just that it's not a like a $200 an hour job. It's a $20 an hour job. You should have a $20 an hour employee doing that, and the $20 an hour employee should be like grateful for the opportunity to do that. And if you have a good culture, like everybody's on board, the doctor's time is valuable. Is my job to clean the room? Doctor, quit cleaning up the room. Go to the next patient, please. Like if everybody is on board, it works well. If you have a good team. If the doctor has to be doing
Teamwork.
only doctor stuff.
Right.
Certainly.
Also, the other part to talk about when you're starting out in practice is also be cognizant of practice is not just the practice of medicine, but also gathering the evidence to be able to do the practice of medicine. So a lot of doctors, when they get out, they tend to go very much straight 100% clinical and then not get into the research side of medicine or the advocacy side of medicine or the corporate side of medicine. And all of those things are important because at some point, I'll evaluate your practice should do well and you should go on to great things and you should go from making 5 million to 10 million by 2035. That's the dream. But you need to be realistic and always have multiple streams of income going because you never know. Like you said, 2025, you were generating 90% more income on skin grafts, and then 2026 hit, and that was all gone. So you have to be cognizant always of how to stay flexible and adjust on the fly. That's the name of the game, especially in practice, because when you start out, you want to be the $5 million practice when you're starting out, but that's unrealistic. So you have to, but at the same time, you have to act like a $5 million practice. So you have to make sure that you have all of your procedures and plans and a good biller that can get the job done for you and make sure that they're always staying on top of you so that you know from minute to minute how things are changing in the field. Because honestly, you don't have time to be always keeping up on the latest and greatest things. That's where your $20 employee or your $400 employee comes into play so that you can be freed up to use what you know and do well and get paid for what you know and do well. Very simple.
Yeah, I agree.
You know, that comes to kind of a question that I have in mind. In terms of operations, doctor, what do you think, like, those mistakes which are silently killing the profit in the private practice? What have you observed so far in terms of operation regarding even billing, even regarding RCM, the coding side of it, all of anything that's come up in your mind that destroys everything silently? And that needs to be something that, we have to keep the eye.
Yeah, there's a really good book called The E-Myth Revisited. What's his name? Michael Gerber wrote it. It's an older book. It just talks about it talks about small business and kind of like how to build or run a small business. Very popular business book. And the thing that it like harps on over and over again is writing down what the business does, who does it, when they do it, how it's supposed to be done. They're called standard operating procedures. They're called policies. And you should have them. That's one thing that we're currently in the middle of. I'm like a lot of small business owners and a lot of entrepreneurs. You have this vision, you have this drive, you start seeing the patients, you start making money, you want to grow, hire employees. And then you have 10 people asking you, how do you do this? How do you do that? How do you do this? You have to make every single decision. You have to make every single call. You have to tell every single person where every single thing is. Here's how to turn it on. Here's how to start it. Here's how to run the machine. And that doesn't scale. I heard a really good quote. Hustle does not scale. Right. Hustle's great. And it's like something people brag about, but it doesn't scale. No. Operations and policies and procedures and systems scale. So you have to write it down. What happens when a grumpy patient walks in the door? Like the doctor, the owner's not always going to be there to be like, hey, grumpy patient, I'm really sorry about this. Let's take care of it. Somebody's going to have to be there. If you're off, expanding or at your second location, here's the policy for taking care of grumpy patients. Here's the policy taking care of patients who show up late. Or every time at the end of the day, how does a room get closed down, or where do the instruments go? Whose responsibility is it to clean the instrument? When do the rooms get restocked? Stuff like that. Who checks the voicemails? Because, well, there's boxes in the hallway. Like, who's supposed to do the boxes in the hallway? Well, if you have a policy about it, or if you have a standard operating procedure, when the boxes show up, medical assistant number one puts them away at their lunch or after lunch or before they go home. Like, if you just have to have it, you have to have it all written down. It's that's the stuff I hate doing is writing it all down, but it has to be recorded. It has to be written down. And that's what a well-run business does. If you go to McDonald's, they
Certainly.
it's not a book. It's not a book. But they used to have a book, giant book. Walk in at 5:59, turn the light switch on at 6 o'clock, turn the air fryer or the oil on at 6:02 to this temperature. And you could just walk into a McDonald's and read the book, and you could run a McDonald's, and it would run just like every other McDonald's because they have the systems in place written down. That's operations. That is for every business everywhere. It's either that or, again, you just stay small, you keep all the information to yourself, and you just remember everything. You can't ever go on vacation, you can't ever leave, you can't ever get sick, because if you get sick or you leave, there's nobody to remember the information. You have to have systems and write it down.
Yeah, you used to call that the freight train, where you set yourself up in such a way that you can never leave your practice, that you now become a slave to the practice because the freight train keeps rolling.
Slave is the right word to be. Yes.
Right. Everybody should have their own workflows, and we should, as a business owners, everybody set up this policy and procedures. The algorithm needs to be there to make sure everybody's following that. So actually, even though if the new employees comes in, everybody should suppose, the transition into any business for the new employee should be very seamless. So that's what we do at the same time as well. We have our own algorithm, the workflow that we all follow to make sure everybody has even for us, it's always about new coders, new billers. So if they're coming up to, for a new practice, we have our own guidelines for every specialty that we have created, and they can, if they read it, they can do the billing. They don't need to be, very experienced in that practice. We follow the workflows for every doctor, every practice. So it actually helps the new people who are just getting, very enthusiastic people who are just getting into the, jobs, who are actually wanted to make some decent for themselves and wanted to do it in the right way. We should supposed to help them as an owners of the firms that this is how it's gonna be. This is how you'll be providing a quality work to the clients, and that goes in every business. We all need to make sure that if you're expanding to more than 100 employees, that's what we did. So we actually created, because it will get messy if you don't do that.
Very
For
messy, very fast.
And it happens very, very quickly.
Mm-hmm.
The other thing I wanted to mention that you were talking about McDonald's is I actually have a philosophy related around McDonald's and podiatry, which is the simpler you make your practice, the more profitable it will be.
Generally, yeah.
Yeah. So, for example, when I was in practice, I did straight chip and clip nails, calluses, ingrown toenails, and that was my focus along with wound care. And we just kept pounding away until I literally ran out of space in my schedule, like you said. And that's when you come to the realization that the best way to start is by keeping it simple, but making sure that simple is good to get you to the starting line, but then you need to make sure that you have everything pre-allocated out, so when you expand, you have some idea of where to go and when to go. And that's where people like Tal will come in and help guide you through that process of saying things like, you're starting to hit that point where it's a little too much on one end. We need to start figuring out another solution here. Let's have a meeting to talk about that. And that's why it's important to have people like that around. But simple. The more simple you make your business, the less headaches you will have, without a question.
Yeah, it's more simple to market too. It's more simple to explain to
Mm-hmm.
patients exactly what you do. Your website doesn't have to be quite as complicated. I had that discussion with my office manager today, because I have 5 doctors, and not all 5 of them do the same things. And we're a little bigger. When I first started, it was wound care. I did only wound care. And then we did the warts and the ingrown toenails and toenail fungus. The big ankle fractures and the surgeries and the sports medicine stuff. I was training how to do all that stuff. I could do it, but I didn't, you can't, I don't know. I didn't market for it. I didn't like it. I wasn't that interested in doing it. But now that I have 5 doctors here, it's not as simple anymore, because I have two of them that want to do strictly limb salvage wound care. I have one of them that
Mhm.
wants to only do MIS. He got all this cool training and likes all this minimally invasive surgery. And then another one that's like, I like to do all the trauma. I like to do all the sports medicine. So now it's like, okay, the way we market is completely different, because now we have to market to the wound care thing, and then we have to market to the MIS thing, and the also
Well,
sports medicine. I mean,
as a
we're
as a
like, should we keep doing this, or should we just just focus on wound care forever and just expand wound care and scale wound care,
no,
or do you
Now it's a
focus on
one-shop stop.
all of it?
no, no,
Yeah, and
no.
so we're just talking some little bit of business strategy and like what exactly
My
where and okay, from a business decision, like where do you make the biggest margin? Where do you get the highest ROI? Do you just pursue that, or do you pursue what you really enjoy and then take a hit on the finances? So we were talking about that today. It was interesting that you bring up simplicity, because if all I did was treat warts all day and did nothing but treat warts, I would know exactly how to market it. I'd probably become an expert wart marketer, an expert wart
hmm
treater.
hmm
You treat all warts. If it's all you wanted to do, go for it. I'm sure you can make $1 million treating warts all day, but yeah, the more complicated you make it, the more complicated it is. That's for
Right.
sure. I agree with you.
The one thing I would say, in particular with your practice and the doctors that you have, you really don't have one practice. You really have 5 marketable practices in that one practice, and you really should, in my opinion, be marketing those 5 doctors separately from each other. Like the one that just does limb salvage, a whole marketing plan should be developed around promoting him and talking about if he has any research, you should be promoting that. If he doesn't have any research in regards to limb salvage, you might want to encourage him to go out there, because the more research your doctors put out in regards to their subject of interest, the more people will start noticing and start sending them patients, because that's all the journal articles that they see.
No, fair. Not bad.
So, like
Yep.
what I do with a lot of practices is what I'll do is I will carve out each individual area, and then we'll create a marketing plan around that individual area. And that's what I see, which is true, is that with most practices, such as yourself, is that you see the practice of medicine in terms of a total scope of, I'm going to do everything. I'm going to be the limb salvage guy. I'm going to be the minimal invasive surgery guy. I'm going to be just the wart guy. Um, and you can do that, and that's great. But you have to remember that if you do that, you really have to create this entity where people know that that is what your brand is.
Right.
Because right now, from my perspective as a consultant, your brand is very much, which is true for a lot of practices. It's a little bit all over the place, and if you could somehow dial that into having each person have their own marketing that follows them with your overall brand attached to that marketing, that would, in my opinion, be a much more effective way to go at
That's
promoting
fair.
your
That's a fair
patients.
point. Yeah.
Yeah, you're creating like a one-shop stop now, so everybody who's gonna
Right.
be learning more about for individual and see what's gonna be a good fit for them.
Yeah.
Uh, Doctor, let me ask you this question: have you seen the burned out in the teams? In the healthcare teams, have you seen something that is like you know everybody, like in every practice there are some good days, some bad days, and how do you take care of those? Let's just say if you're an employee or if one doctor is not having a good day and they all are burned out, have you seen any kind of the situation, make it, still being very calm and take care of everything?
Yeah, burnout. So I stay active on LinkedIn, and there's at least one post every single day about burnout with doctors, why doctors are leaving medicine. Medicine is horrible. Healthcare is going
Hmm.
downhill. Whatever, the future of healthcare, doom and gloom, and it leads to all this burnout. It gets talked about all the time,
Mm-hmm. Mm-hmm.
and it is real. We're all um, there's a lot of problems in healthcare, and like we don't have a lot of solutions, so it doesn't give a whole lot of hope, and I feel like that's where a lot of the burnout comes from. I don't really believe that burnout comes from like consistent hard work all day every day.
Hmm.
You look at like Olympic athletes, and they are like focused on one little teeny tiny dumb little skill all day every day.
Hmm.
Those people don't get burned out. They have some hope, something to look forward to, a goal that they're trying to achieve, and it's worth putting in the effort every single day. Like I feel doctors are at least kind of in that same realm where like, hey, I have something that I work hard at every single day, you go to school, and then you get through school, you go to residency, you get through residency, and then you start working. And if you don't have any like hope to hang on to, if there's no like target to hit when you're going, if you're not working towards anything, and then your future is maybe doom and gloom, or your future is maybe uncertain, or there's no, like, if you're not working towards anything productive, if you're just looking forward to the weekend, looking forward to my vacation, like I can't wait to get rid of these 30 patients on my schedule, burnout's really easy to feel. I don't know, you could work 12 hours a day, 7 days a week on one thing and absolutely love it. If you do that, like, burnout's um you don't get burnt out. I don't know, I work a lot, and I don't feel like I'm burnt out. I'm so excited and jazzed about the future. And look, I'm so positive about like where healthcare is going. There's tons of problems, but at the same time, there's so much abundance. Healthcare will never go away. Diabetes will never go away. Wound care will never go away. Like pain will never go away. Joint pain, bunions, none of that stuff is ever going to go away. I don't care what happens with like the government or the Medicare or the insurance. Like, something will happen. It can't keep going downhill, and reimbursements keep going downhill, and insurance premiums keep going up and up forever and ever and ever. Something will happen. I don't know what's going to happen. But healthcare won't go away. Doctors won't go away. Patients won't go away. What we do see is that there's less and less doctors coming in, so there's going to be more and more demand for doctors. There's going to be a higher, supply and demand is going to be in the favor of the doctors, which there's no way that's bad for any doctor anywhere. I don't know how it all plays out, and I don't know like where all the money is going to come from, and I don't know like how the patients are going to be affected. But anytime the supply and demand ratio is in your favor, there's some positive to be taken from that, and there's some abundance to be taken from that. So I don't feel doom and gloom. And even if I do feel some doom and gloom, like I don't care. I still go to work every day. I'm still going to help. I got something to shoot for. I got something to work for, and I got a lot of hope for the future. I try so hard. We share like an inspirational thought every morning, every single day. We say the future is bright, and then the whole entire office says so bright. We talk about wins from yesterday, and we stay positive. And I hope it gets through, and I hope they feel like we're doing something good. We're helping people. The future really is bright. There is some, somewhere for me to go. There's progress for me to have in my career. That's how I fight against that. I, try not to listen to the doom and gloom. And if I do, I try to be like, hey, it's doom out there. Why don't you just, I don't know. Your mind's a powerful thing. And if you listen to the doom and gloom and the bad news all the time, it's going to be doom and gloom.
Absolutely. I myself have the same roots for the like doctors, my sister and everybody, my mother, and and the same industry that I got into from in these years. I love what I do. I personally, like, doctors love to treat the patients and help them out. We as a consultants love to treat and help the doctors out with their businesses and everything. And I work like maybe sometimes like just 16 hours a day, 7 days a week, twice on Sunday sometimes. I love doing what I do, right? So I think the only, there are some good days, right? You can get some burnout, but if you have that goal, if you got to do what you got to do every day, you just need to do it. You cannot just, blame yourself. You cannot just let yourself down for a moment. You need to, because let's just say, you have built a wonderful business so far. Let's just say if you hit that mark by 2035, or maybe I wish it gonna be more earlier, what legacy do you think you want Clover Podiatry to leave behind?
So what legacy do I want to leave behind? So even if I don't hit, even say I max out at 10 million, I just stay at 10 million every year. I'll be satisfied with that. No, I don't know if I'd be satisfied. I would be happy as long as I'm working for it and working towards something, whatever. I'll do the best I can.
Let me ask you this.
My goal, what do I want the legacy to be? I'm like everybody, not everybody, but like most people who get into Medicare, healthcare, when you're a kid, they say, why do you want to be a doctor? I want to help people. Why do you want to be a doctor? Well, I want to do something good with my life. I want to do something productive. Really, like what I do, I love people. I love taking care of people. My favorite thing to do is make somebody smile. And if you can just do that to as many people as possible, um, um, just making as big of an impact and deep of an impact to as many people as possible. That's what I'm shooting for. That's what I'm going for. That's part of the motivation for growing so big. After you have a certain amount of money, like making more money doesn't make your life better. And so I'm not
Hmm.
really like pursuing more money. It's just like what kind of an impact can I make on the world? If I had
Right.
all the money and I had all the free time and I had all the freedom, because that's what money is for. Like you use money to buy back your time, you use money to buy back your freedom. Like, what if you had all the time and the freedom? Like, really, what people are at their core shooting for is like, what kind of an impact can you make on the world?
Hmm.
Unlimited freedom, unlimited time, unlimited money. Like, what are you going to do with your life? You're going to do something impactful, something. That's what you want the time and the freedom and the money for. So that's what
You
I'm
know,
that's what I'm shooting for. Like, how big of an impact can I make? And if that means, like maybe spread some joy and happiness in the healthcare community, great. If that means take care of a billion feet over the course of my career with my company, like that's great. Yeah, just
as
yeah,
far
maybe
as
not
I
make
understood,
healthcare so doom and gloom. Yeah.
yeah, as far as I understood you, and you're more like as an entrepreneur, you're more like a people who like to make a significant impact on everybody, who
Yeah.
keeps like partnerships over business, and someone who's not here to compete, who is actually here to rule, for his own. And the
That's a
only
good one.
yeah, that's what I give out to the people who
Yeah.
actually ask me. you know, and as far as I understand, then the best patient experience will give you the goodwill that you need, and at the same time you grow in terms of your business too. If you're doing it right with the patients, if you're
Mhm.
spending everything on them, if you have a wonderful patient experience in the business in terms of healthcare, you will get eventually you get the revenue, eventually you get the success, you
A-
get your name,
Absolutely.
everything.
There's also something about what you just had said is that you reach that point where that you make so much money that the money becomes meaningless, and you're now searching for something other to find meaning in your life. For me, over the last 5 years, it's been about uh, starting to build research and helping to find answers to questions that I have. And for somebody that may be their next path. But the point I'm trying to make is that you have to prioritize your mental health and make sure that you're feeding that as much as possible, because if you're starting to get burnt out, your patients will notice it, and it does affect your clinical success without a question.
Yeah, unhealthy doctors don't give as good of healthcare advice as healthy doctors do, and that goes for mental health.
Correct.
Or at least it's not perceived by the patients as well.
Mhm.
One thing I always do is I'm a huge Star Wars fan. So anytime there's a new Star Wars movie coming out, I always will say, okay, 6 months from now, I need to make sure that I am at this theater seeing this seat to see this movie. And that is my goal. And having some stupid, simple goal that you can put out in front of you as the carrot will definitely carry you through those days when your practice is not behaving and when you're overwhelmed or overloaded, is having that little carrot dangling in your head going, down the road there's this, so I push through this and I can get to that. And that's a little tip that I use all the time in
Yeah,
situations
having a
like
target, having something to shoot for, having some
right
some reason for hope, some reason to continue. That's yeah,
for
it,
mental health reasons. Yeah,
it
it's
yeah,
huge.
it prevents burnout. Like you don't have burnout if you're just working towards something all the time. You're just
Right.
working, and working's good for you.
But
And
at
also,
the at
like
this
doing hard things is good for you. If it was just a cakewalk every time, it wouldn't be worth anything.
but at the same time, it's also as you further along, because you're 5 years into a practice, and I know
Yeah,
for like the first 7 years I was all super gung ho. I'm gonna
yeah,
make everything. I'm gonna push to the wall. I got kids
yeah,
coming. I got I got tuitions to pay for. I got computers to pay for. I've got kids that want PlayStation. So I got to work, work, work. And then you hit that 7 year mark and you go, okay, I did all that. Now what? So then that's when you start really putting value on your time to make sure that when you're practicing, you're 100%, but when you're not practicing, you're also 100%, because you can't
Yeah,
go on that way forever.
I heard this really neat idea about a year ago. Really changed my life. It was somebody was talking about work-life balance and don't we need work-life balance? And doctors have a really hard time finding work-life balance. Residents
Mm-hmm.
have impossible work-life balances.
Oh yeah.
Students, medical students, there's not a good work-life balance. And then business owners also, there's no good work-life balance. And I heard somebody, he's like, there's no, don't, you shouldn't chase work-life balance. It shouldn't be balanced. You're a business owner or you're a father. It shouldn't be balanced. It should just be aligned. And you can have work-life alignment. Work-life alignment is so much better. And it doesn't have to be 8 hours of sleep, 8 hours of play, 8 hours of work. You can do 12 hours of work and 6 hours of sleep or 2 hours of sleep if it's required. And, like 5, whatever the math makes out to, it's okay to be imbalanced as long as it's aligned. And I was like, oh my God, it was so mind opening. I thought, oh, thank you. I don't have to, like, 'cause I'm worrying about myself. I'm like, oh man, I don't have any work-life balance. I don't have any work-life
Mm-hmm.
balance. I'm at the office all the time. And I was so thankful for that, because I've thought to myself, like, it doesn't need to be balanced. It can totally be off balance, but as long as it's aligned, if working for the 14 hours makes sense and is helping you reach your goals and provide for your family and provide for your employees and is
That's wonderful.
fulfilling in your life and is making you happy, or if working 1 hour, and playing for the other 23 hours is aligned with where you want to go and what you want for your family and for your team, like,
Mm-hmm.
knock yourself out, man. Just make sure everything's aligned. And that's it's okay to be imbalanced. In my opinion, your life should be imbalanced. When you're single, it's
Mhm.
way different than when you're married. It's way different when you had kids, or if you're a business
Mm-hmm.
owner versus an employee. There's nothing's like really balanced, and that's okay. And it's work-life alignment is so much better. There's such better philosophies like in the last year since I've heard that idea.
I
Indeed,
like that
indeed.
idea. Thank you.
Um, no, indeed, doctor. Because once you're like when you're an employee, that's where we all been in some time in some part of our
Sure.
lives. We all look at the clocks and wait till it says 5 and we leave the office, because
Yeah, yeah.
that's how it works. But if you want to become an owner of the business, or if you want to get out of that comfort zone, you should stop looking at the clock, you know till the work gets done. Once that is
Amen.
done, you can leave the office, go ahead, do what you want to do. Same if you're aligned, either you're working 2 hours a day, if it's gonna get you somewhere where you want to be, it's wonderful. And even if that requires 23 hours of working, do that. You should
Mm-hmm.
supposed to just work right on your goal. You should supposed to know what exactly where I want to be next this set of time period. And that's how this is the kind of a mentality that the business owners, the entrepreneurs have, because they don't look at the time. They work till the job gets done. That's how it goes. And this is, I think, the only way you can get successful in your life, because you gotta work hard. You cannot just, if you want to leave kind of a legacy or something that people can look up to, you need to put it some extra efforts for that. It can be happen if you're not doing something extra. So there is sacrifices.
Yeah.
There's again, that is kind of a part of the game.
Right. The thing I
Yeah,
always
yeah,
told the
absolutely. And anybody, yeah, that's for anybody. Yeah,
right.
absolutely.
The thing I always told the kids is that I started out in practice, I said, guarantee every fall you will get sick and you will be the first ones to get sick. It's just part of having a dad who's a doctor. I bring home everything that all my patients have. It's just part of the name of the game,
Yeah, fair.
and that's part of the sacrifice that the family makes. And you have to be just like for your business, you have a business plan. You should also have a personal plan that tells you how you're going to carve out your days, how you're going to make sure that you are always, because you could easily fall in, like you said, into the loop of constantly work, 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 work. and never see the forest from the trees. So finding that balance doesn't mean being perfectly balanced. If you're off balance, there's something wrong. Ending up walking around like a zombie because you're just working too much. And you won't ever tell yourself you're working too much until it actually does happen. So be careful with burnout. The other thing, uh, and I forgot already. First thing, burnout, burnout. Don't worry about burnout. Just go and live your life.
Did. And before Doctor, we gonna be, ending the whole conversation over just one question that I have in my mind to ask you. If a young doctor wants to build a successful private practices today, just like you, where should they start? What advice do you want to, let off, leave behind for the new grads who are just coming out of the schools or just starting, or even those who are just, wanted to kickstart everything, go open their private practice, want to be just like you, where they should supposed to start, what should supposed to be there, kind of things that they need to be aware before they get into the business and become an owner, obviously,
So
for everything. Because once,
yeah, there's a guy on social media that I follow a lot. His name's Alex Hormozy. He invests in companies. He's run a couple companies. He runs gyms and whatnot, or he used to. And he gives this really good piece of advice where it was, I forget how he says it, but it's something like it only takes like 30 hours to become like better than most people at like a certain skill, but most people put off the first hour um, forever.
Mhm.
I don't know how he says it, but basically, if you're going to do it, just decide to do it, and then jump right in. Get the LLC, get the big bank account, get the place, and just start going, and don't expect to make any money for an entire year. That was, somebody told me that when I first started. I was like, no, I'll be making money in a few months. You're going to make $0 for one whole year, so be able to tolerate that, and then
Manage.
just do it. I literally, we found a building. I got free chairs from an old podiatrist that was throwing them away. I took whatever I could from whoever I could. I got loans, made nothing. We lived in a little teeny apartment. I just made it work, and then went around and knocked on doors. And they're like, "Hey, it's COVID. Leave your business card on the doormat outside in the rain. We'll come get it after you run away with our masks on." So I just do it. Just do it. It'll happen. There's always room everywhere in every market for a good doctor. So I would say, number one, just do it. Decide you're going to do it, and go ahead and start. And then also plan on making $0 for a year, and plan on your schedule not
Mhm.
being full for an entire year. It's hard to do. It's a long freaking time to do anything. But I feel like that's a realistic expectation. And the other thing I would recommend is find somebody else who has done it, or has done what
Mhm.
you want to do, or has helped somebody else do what you want to do. So find a coach or a mentor that's done it. And if it costs you money, pay him the money. If it costs you money, pay him the money, because if it costs $10,000, you will easily make at least $10,000 in mistakes without help.
And
The ten
True.
thousand dollars will save you probably $50,000. So it's that's what I did. I paid a coach, help me do the business plan, help me do the bank account, made sure that my space was big enough, or I had the right instruments. Where the crap do I buy an X-ray machine? Where do I buy toenail clippers from? Um, I paid a coach $10,000. I would have made at least $10,000 in mistakes. Went ahead and did it, and I just made sure that I was okay with not making any money for a year. I had a wife and kid. She was 100% on board. If you have a support system like that, you're super blessed, like I was. If you don't, find a way to make it work. Find a way to make it
Certainly.
work. Those are the three things that I would recommend. Just start, get some help starting, and then plan on not making any money. If you're going to go out and start from scratch, buying a practice, it's different. Still, I would get some help doing it. I would go ahead and start doing it. You'll make money a little bit quicker. You'll also inherit a whole bunch of stuff you're not used to taking care of. So there's pros and cons of both, but start, get some help doing it, and
Well,
just be patient.
that's a wonderful advice that I would say. Talking about in terms of right partners, do you think you're when you're starting up, choosing a right billing company or right RCM consultant who can actually guide you about these insurances and the codes and all of that stuff to make sure that you're getting paid because most of the doctors starting taking insurances, the headaches of credentialing, the coding side of it, the billing side of it, they're choosing a right
Yeah.
EMR. Is it like, do you think most of the successful doctors rely on their billing partners at the same time as well?
Yeah, so my coach had a recommendation for like all the hardware I bought. My coach had a recommendation for where I got the dumb phones from, where I got my X-ray from. She said, "Here's the billing guy. Use this billing guy. Here's this EMR. Here's the three." I was like, "I don't want to test out three EMRs. You just tell me which one's
Right.
the best. You're the consultant." They said, "Use this
Mhm.
EMR." It's like, "Here's five billers." I was like, "Just tell me who the best biller is. I'll use them. And if it didn't work out or wasn't a good fit, then change later." But I it was an instant team of people that I could go to and ask questions for,
Right.
because one person is not going to know all the coding and billing and how to run the X-ray machine and how to turn on your like Dremel that's doing the toenails. So with one coach and one contact, I had like 10 instant contacts. Um, it made all the difference. Probably would have
Mhm.
taken 2 years to get full if I figured out how to do it by my own on my own.
Mhm.
So doing that, having the right contacts, and then just read books, listen to podcasts like this, talk to people, ask questions. Like you can have absolutely no shame when you're starting a practice from scratch or starting a business from scratch. Tell everybody all your ideas, ask for all the input, and ask input from people who have done what you wanted to do. If you're, I don't know, if if you got your like a buddy across town who's never run a business before, I wouldn't get a business advice from him. And they like to offer their business advice often. So, yeah.
Indeed,
Yeah.
indeed.
I get it all the
That's
time.
very
Hey, you
spot
should do
on.
this. Hey, you should do that. I'm like, yeah, thanks a lot. I appreciate your advice. And I just forget it.
One bit of advice I would
That's good.
recommend
It's
for
good.
most of the
You
time.
know what?
Oh,
Go ahead.
yeah. Sorry. He was saying something.
Sorry. The one bit of advice I would recommend to most of the doctors is also look at your population size when you're comparing the number of doctors in your community to see if there's enough patients to support another doctor in that community. A statistic I
Mhm.
always use, for example, for evaluating wound care centers is 400,000. That seems to be the magic number of bodies that you need in order to have a good, sustainable wound care center. That'll give you enough bodies coming through the door. So whatever that number is for you for podiatry, have that in your head as this is the number that I need to have of potential patients. And it's a very simple calculation that you can figure if you have any background in statistics of taking the 10% from the top, and that would be the number of people that should be coming through your door in theory.
Yeah. And AI can answer a lot of questions like that. If you
Right,
like, how do I find that information out? Just, yeah, AI, hey, I want to open a
right,
practice. What do you
correct.
recommend? And again, I wholeheartedly believe that even if there is a lot of podiatrists in the area, if you're really going to offer better care and you're really going to do a better
Right.
job and be able to see people, there's always room for a good doctor in town because there's always bad doctors in town.
Of course, of course.
And there's always
And
average doctors in town. So if you're going to be an excellent doctor, there will be always be room for an excellent doctor.
of
Absolutely.
course, of course.
Absolutely.
And then, and okay, I'll stop.
No, no, we're doctor. We're just about to, going for the closing line. We'd love to hear what you're gonna say.
Okay.
Go
Well,
ahead.
I mean, the big thing is keep it simple. Don't overcomplicate things. Learn your codes the first day along with the prices, and then take that price sheet and throw it away. And then just focus on treating patients because as the patients come through the door, you will make money, guaranteed. But make sure that you stay focused on what is important, which is treating the patients, and that everything else magically seems to work itself out between having billers to help you, having a good office manager, especially if it's your wife, and things have a tendency to work themselves out. But just making sure you have a good team around you so that you can focus on what you need to do to make you successful. Period.
Yeah, amen.
Thank you,
Patient
doctor.
experience is number one. Yeah, if you take care of your patients, everything else takes care of itself. That's the one thing that if it's true, everything else takes care of itself, and that's important to like understand in business.
And after
Yeah,
No doubt.
25 years, that has never changed.
yeah, and I don't. It will never change in healthcare, in my opinion.
Correct.
If it
Correct.
does, I don't know. I'll be wrong. So yeah, but
If
it'll
you're
never
if
change
you're
in
wrong,
healthcare.
you're not going
100%.
to be in business anymore.
Yeah,
It's very
yeah,
simple.
yeah, and I'll be okay with that.
Yes, exactly. So it's better to be
Well,
wrong than to be president, as my mother-in-law used to say.
wonderful. Well, I would say it's we had a wonderful conversation so far, and I believe a lot of new grads or the people who are just like to get into the business want to take care of everything by their own and want to provide actually a wonderful patient experience to their patients. I would say they're gonna love the podcast. They're gonna love what Dr. Fish you said so far, the advices, everything, your journey so far, the vision that you have for next 10 years. It's going to be what I think is you can almost accomplish everything, but if there's still 10 to 15% is left on your end, you're gonna get that too soon. Very hopefully, we're gonna wish for that, and stay focused like this. That you are doing, you're doing a wonderful job so far, and if you keep doing that, I believe not unless you're gonna be, you're not just gonna be successful as a entrepreneur, but a wonderful podiatrist brand in the in the country. So let's hope for that, and we're gonna do some more podcasts like this to help out the new grads and new people who are getting into the business and see if we can help them out in any manner possible. Healthcare by itself is very complicated. Let's just make it a little bit more easier for the others so they can learn from it and make some right steps to their path and actually get eventually successful in their businesses too. Amen for that. And again, Doctor, thank you so much, you, Dr. Fish, and Dr. Leon, for joining the podcast. It's a pleasure to meet you all
Pleasure.
again today, Dr. Yu. And I hope to see you guys soon again, hopefully. And we're going to stay focused, make sure that healthcare, whatever we can do as an input, we will be keep doing that to make sure that we can help the others out there to, you know, a little bit as soon, like as much as we can. That's what we can do. And hope to see you guys soon.
Amen.
Yeah, thanks so much. I appreciate you having me. Yeah, it's a joy. And
It was
good luck to
wonderful.
all those people out there. There's plenty of abundance to be shared all around. So
Amen.
Indeed. Thank you so much, doctors. Have a wonderful day and look forward to speaking with you again. Good night. Take
Okay.
care.
Good night.